Have you ever felt that sharp twinge in your shoulder when reaching for something overhead or tossing a ball? Or maybe you've noticed a nagging ache that just won't quit, no matter how you rest? These subtle signs could point to a common, yet often misunderstood condition, rotator cuff tendinitis. Today, we're diving deep into what causes this frustrating issue, why it keeps you from doing the simplest tasks, and, most importantly, how you can overcome it. Shoulder pain can be one of the most limiting problems, affecting everything from your sleep to the ability to lift a grocery bag. Ignoring it won't make it go away, in fact, it'll likely make it worse. But what if you could understand the problem, treat it effectively, and get back to living pain-free? What is rotator cuff tendinitis? Picture your shoulder as a perfectly designed machine, made up of bones, muscles, and tendons working in harmony. When everything is running smoothly, you barely notice the effort. But when the tendons in your rotator cuff become inflamed, the whole system comes to a grinding halt. Rotator cuff tendinitis is like having sandpaper in the gears of your shoulder, leading to pain, stiffness, and even swelling. Everyday actions, like reaching up to grab something off a shelf, or tucking in your shirt, become major challenges. While this condition is often called impingement syndrome, the name doesn't matter much when your shoulder feels like it's giving up on you. What does matter is understanding how this seemingly small issue can grow into a major disruption in your life. The silent start, symptoms you can't ignore. At first, rotator cuff tendinitis might be mild. Maybe a little ache here, some stiffness there. You might think it's just fatigue or the aftermath of a workout. But over time, these warning signs escalate, making simple tasks, like raising your arm, feel like lifting a weight far heavier than it is. Here's what to watch out for: pain when raising or lowering your arm, that little pinch that feels harmless at first. Shoulder stiffness, making movement feel restricted, as if your shoulder is resisting your every command. Tenderness at the front of the shoulder, touch it, and it feels sore, even swollen. Sharp, sudden pain when reaching overhead, this is your body's way of shouting that something's wrong. Clicking sounds or sensations, as if your shoulder is grinding inside. These symptoms can sneak up on you gradually, especially if you're involved in activities like pitching a baseball, swimming, or playing tennis, motions that involve repetitive overhead actions. When symptoms escalate, the real struggle. As the condition worsens, the pain doesn't stay confined to daylight hours. It might wake you up at night, forcing you to switch positions again and again. You might struggle to reach behind your back, even for something as simple as zipping up a dress or fastening a seatbelt. And let's not forget the loss of shoulder strength, which can leave you feeling like you've lost control of your body. Rotator cuff tendinitis can sneak up on you slowly, or it can hit suddenly, especially after an injury. Either way, the pain becomes an unavoidable part of your life. Diagnosing the problem, how to spot it before it gets worse. If you've noticed these symptoms, it's time to see a doctor. They'll ask you about your shoulder pain, when it started, how it's progressed, and what movements make it worse. A physical examination will involve moving your shoulder in different directions and testing its strength by pressing against the doctor's hand. Sometimes, imaging tests like X-rays or MRIs will be needed to rule out other issues. But here's the good news: many people can treat their rotator cuff tendinitis without surgery. Treating rotator cuff tendinitis, the power of small changes. For mild to moderate cases, treatment starts with simple steps you can take at home. Let's break them down. 1. Rest. This isn't just any rest. This means actively avoiding activities that irritate your shoulder. Overhead movements. Off the table. 2. Cold therapy. Apply an ice pack for 15 minutes, several times a day, to reduce inflammation. 3. Anti-inflammatory medications, over-the-counter pain relievers, like ibuprofen, can be a big help in reducing swelling. 4. Physical therapy. This is where the magic happens. A therapist will guide you through stretches to restore your range of motion and exercises to strengthen the muscles that support your shoulder. One simple exercise that can make a world of difference is the pendulum stretch. You lean forward, letting your arm hang freely, and swing it gently in a circle. This helps loosen up the shoulder without putting extra strain on the tendons. Another is the crossover stretch, where you gently pull your arm across your chest to stretch the muscles at the back of your shoulder. These simple moves can help bring you one step closer to full recovery. When home remedies aren't enough. If rest, ice, and physical therapy don't do the trick, your doctor may recommend steroid injections. These powerful anti-inflammatory medications go straight to the source of your pain, offering relief when other treatments have failed. However, injections aren't a long-term solution, they're more like a reset button that allows you to continue with less invasive treatments. In severe cases, when the tendon is torn or heavily damaged, surgery might be the best option. The surgeon removes part of the inflamed bursa, a fluid-filled sac in the shoulder, to reduce friction and make room for the tendons to move freely again. Recovery from surgery can take a few months, but with the right post-op care, most people regain full use of their shoulder. Protecting your shoulder, prevention is key. Now, if you're thinking, I don't want to end up with shoulder surgery, you're not alone. Prevention is the key to keeping your shoulders healthy and pain-free. The best way to protect your rotator cuff? Avoid the movements that aggravate it in the first place. Here are some tried and true tips. Stretch daily, especially if your job or hobby involves repetitive motions. Maintain good posture, whether sitting, standing, or walking. Keep your shoulders back and down. Take breaks from any movement that requires reaching or lifting overhead. Sleep smart, on your back or alternating sides, to avoid putting pressure on the shoulder. Listen to your body, rest as soon as pain begins, and avoid pushing through discomfort. Complications of ignoring tendinitis. If left untreated, rotator cuff tendinitis can lead to more severe issues, including chronic pain, reduced mobility, and a loss of strength. It can even affect your ability to sleep, drive, or perform everyday tasks. And, in some cases, prolonged irritation can lead to a complete tear of the rotator cuff tendon, requiring more invasive treatments down the road. In conclusion, take action, don't wait. Rotator cuff tendinitis isn't something you can afford to ignore. It may start as a minor inconvenience, but without proper care, it can take over your life. The good news is that with rest, the right exercises, and, when necessary, medical intervention, you can get your shoulder back in working order. Take charge of your shoulder health today. By addressing the problem early, you can avoid unnecessary pain, discomfort, and even surgery. Whether you're an athlete, a weekend warrior, or simply someone who relies on your shoulders to get through the day, protecting your rotator cuff is essential to maintaining a pain-free, active life.
War.